So,
okay.
Luigi Mangione has inspired a ballot initiative in the state of California. The ballot proposition would effectively require health insurers to cover all treatments at any price. It is a direct shot at United Health. Now, perhaps this is a better way to go about trying to get CalCare passed in California, because they've had the bill. The bill exists to have a single-payer health system in the state of California, which has the economy capable, a state economy capable of handling a single-payer health system. And so this is a proposal that would involve his name and likeness have appeared on T-shirts, graffiti, and in so many memes. Now Luigi Mangione, the alleged, I didn't see nothing, neither did you, Jen, of United Healthcare CEO Brian Thompson might have his name end up in a California law as well. Wouldn't that be ironic? I think it's very deserving.
That makes a whole lot more sense than giving the IDF a Nobel Peace Prize. So,
Jen, you're asking for way too much. Over the weekend, California news outlets reported that a proposed ballot initiative titled the Luigi Mangione Access to Healthcare Act has been submitted to the California AG's office for review. Oh, at least Kamala Harris isn't there right now. The proposed initiative's title is predictably drawing a lot of attention, as it is named after an alleged the proposed initiative's author, retired LA-based attorney Paul Eisner. How much you want to bet he's anti-Zionist, Jen? I got a feeling. I got a good feeling.
Okay.
Says that that's kind of the whole point. It is getting the attention it needs because sometimes things require publicity. I would agree. In fact, some of the best bill writers on the Hill typically make bills have pretty attractive acronyms because that's what draws attention to it. While it has certainly attracted publicity, the controversy over the proposed ballot initiative's working title has distracted people from its even worse substance. Eisner's proposal states that no insurer may delay, deny, or modify any medical procedure or medication recommended by a treating physician, or even demand reduced payment for such treatments, if doing so could result in disability, death, permanent disfigurement, or the loss of reduction or any bodily function.
What are the odds that this passes, though? Like that, I don't know what their state legislature looks like enough.
That is a great question. But you know what I'm reading when I'm reading a bill like that? I'm reading a whole bunch of line items that needs to be checked off at any one time. Is this person telling the truth on this? Is this person telling the truth on that?
All they're doing is adding a layer to the bureaucracy. Of course.
That's it.
That's all it is. You're just adding another layer to the bureaucracy, to the middleman with their handout.
So you know what the solution is? I think I just mentioned it. And the person who runs the Ron Paul Institute couldn't dispute my point. The only solution is a single-payer healthcare system. That is it. That eliminates all the waste, fraud, and abuse. In fact, if we're smart, and I think you and I have a decent amount of brain cells together, although you've smoked a few of them away, but I think you're still pretty sharp.
I try.
I think if we were really advocating consistently about how single-payer is Doge in healthcare form, that is what it is.
Of course. Well, that is yet another area that doesn't benefit them to cut. That's why Doge is not it's not the Department of Government Efficiency. It's the Department of gutting what other people need. They're not making the government in any way more efficient. They're just cutting services for people that need services. So that's not, you can call something whatever you want. You can make up whatever ridiculous acronym you want to make up. What they're doing is cutting resources for vulnerable people. That's what they're doing. Is it also eliminating some waste? Probably. I'm sure there's plenty of waste. There was waste in the Department of Education. There's waste all over. There's no shortage of waste.
It has been determined.
They're not in this to get rid of, they're not in this to make the government more efficient. They're in this to line their pockets.
Of course. But one thing that has been indisputable, and this has been brought up, I believe it was the Cato Institute, if you guys can correct me on this if I may be wrong, but I believe it was the Cato Institute, which is one of the most powerful corporate conservative think tanks in all of DC, that it was determined that even according to their calculation, if we were to implement a single-payer healthcare system in the United States, it would save in excess of $500 billion in waste, fraud, and abuse every single year. That's incredible. And that, to me, if we're going to push forward, has got to include that type of messaging. If you believe in Doge, and you believe that Doge's principles, which were put, remember, Doge was put on the books in 2009 by Barack Obama. This has been around for a long time. Have more connective axions. Sable, it depends on how much we're smoking. Is that not fair to say? I mean,
but it's a very relative term. Point is, I've gotten a lot of love in the comment section about your comment about my cannabis usage. Honestly, I think it keeps me sharper.
I think it's fine.
Like the little things, definitely I forget details. Like I do forget details, but I don't know that I ever was that sharp about them. But it makes me so much more capable of going down the rabbit holes that I go down and researching things that I research and really being able to understand and focus on what I'm looking at. And so in that way, to me, I think it makes me smarter. But yeah, I do lose a lot of details. I'm also pushing 54. So, you know.
Well, I'm here to back you up. I think cannabis should absolutely be legal, and we should have a single-payer health system.